According to recent research published in the Journal of Adolescent Health, identifying period poverty in adolescent and young adults among low and middle income countries has been widely studied, highlighting data of disparities, negative downstream impacts, and more. In high income countries, however, little data exists, prompting researchers to further explore prevalence. Now, those researchers join us to explain what the available data show and the lack of available and published controlled trials for intervention.
Hi, my name is Dr. Elizabeth Alderman. I'm the Chief of Adolescent Medicine at the Children's Hospital at Montefiore, and I'm also a professor of pediatrics at the Albert Einstein College of Medicine.
Hi, I'm Julie Samuels. I'm a fourth year medical student at Albert Einstein College of Medicine. So, in our research, we defined period poverty as inadequate access to menstrual hygiene tools. So, any supplies used to absorb blood during a menstrual period, as well as access to washing facilities and proper waste management. And an important part of our study is that any individual who menstruates can experience period poverty. While there's been an abundance of research in low and middle income countries, establishing that adolescents and young adults experience poverty in those locations, we specifically wanted to look at how individuals in high income countries are affected. In one school-based study, we saw that people who expressed period poverty had higher rates of school absenteeism, and that might be a marker of how to assess for it. After performing the systematic review, we identified 8 studies that demonstrated that period poverty is an issue in the US and Canada. And we found variable prevalences of period poverty ranging from as low as 9.8% to as high as 65% across different settings, which included both national and more localized samples. And then another component of our project is we were trying to identify if there were any effective interventions to deal with period poverty in high income countries. And unfortunately, we did not find any effective interventions as part of this research. We had an inkling that if poverty exists and that knowing that there are structural determinants of health within high income countries, that it's likely that period poverty goes hand in hand in that. But really the jumping off point for this project was diving into the research and looking to see what exists and not really coming up with anything.
Yes, I agree with Julie that, that wasn't the purpose of our research. And honestly, lack of access to period products could really exist for anyone, whoever they are. If they menstruate and they need to get products, there are circumstances beyond financial that could prevent them from accessing these products.
So, what can clinicians do to increase awareness and be advocates to curb period poverty that does exist in high income countries like the US and Canada?
The main thing is for clinicians to assess for this. Anyone who menstruates can experience period poverty, lack of access to period products, and also lack of access to medication that might be necessary to treat other symptoms related to periods. So we as clinicians need to ask the question, when we have a patient who can menstruate, is menstruating, are you having trouble getting napkins, tampons, or any other product that you might need related to your period? Asking the question point blank. And perhaps in some places, in some institutions, there are screening for social determinants of health, and perhaps this could be added to something like that. The other thing we can do once we know the answer to that question, that our patient tells us they're having trouble getting period products, is to lead them to resources. In New York City, the public school system has free period products from 4th grade on in their schools. In many places in this country, there are food pantries or other type of pantries that do contain free period products. Colleges may have a place on the college campus where free period products could be accessed. So as a clinician, it's important to find out where these resources are in your community. And lastly, as a clinician, to advocate for screening for period poverty, teaching our patients about where they can access period products in their community at either free or low cost, and finding out and advocating for more access through public institutions, particularly the New York City public schools have it. So many of our public institutions could be places that would give access to our patients. But as clinicians, we are advocates, and we can use the channels for advocacy to do that.